right, so who do we have with us today?
Joe.
Joe, good. So what kind of problems brought you to our office?
Knee pain.
So is it both, or?
Yeah, both. But particularly my left knee.
Okay.
It's arthritic, and
What's it not doing that you want it to do?
just be more active on it. It just stiff and sore, and
Okay. So does it interfere with some of the activities you like to do then?
yeah, absolutely.
What's your favorite thing it's interfering with?
Golf.
Golf.
Yeah.
Okay. So it's just harder to either swing or to walk the course, or both?
Both, actually. Just
Okay.
a combination of everything.
Okay. So if I was to ask you what your typical average daily pain number is, what would it be on a 1 to 10 scale, 10 being the worst?
About a 5 or 6, maybe.
Okay. So what does it feel like when you try and squat down?
It hurts.
Let's try it. Let's see what it looks like.
Okay.
Okay. So you go ahead. I'll back up so we can watch. So it's not even 90 degrees. What's that at that? Oh boy, look at that face. What was that number?
It was getting 8 or 9 or
All right.
7, 8.
So we're gonna do Trigenics on some muscles that we found that your brain wasn't making the right tone in. Some are too tight, so the muscles are very weak. And then we're going to look at a clock here and see what time it is, so we can get an idea of how long you can actually, how fast you can get results, really. So
Okay.
we'll go ahead and come back and we'll redo that test and see what it looks like. Okay?
All right.
All right. All right, Joe, we're back with you now. You did say that you had surgery on your right knee, but you still have pain there too.
Yeah.
All right, so just wanted to add that to the
Right.
first part. Now, we just had you walk down the hall after your first Trigenic session, and you noticed that it felt like you said you were more
Imbalance.
imbalanced.
Yeah.
All right, so now we just did a procedure, and now it's about 15 minutes later. So let's do that same bending and see how it feels to you now.
Okay.
See what happens.
Holy smokes. Wow. Oh my God.
What do you notice?
Jeez, I can bend down a lot further with less pain.
Yeah, so before we got up to a 9,
Yeah.
where were you there?
It felt pretty.
It's hard.
It felt like I was getting down there pretty good.
You were, but as far as how much pain were you in? You had a 9
the pain
before.
was a lot less. I'd say maybe can I do it over again?
Yeah,
No.
do it again.
No.
Go ahead.
Um,
See if it's for real. Well, we want you to check it out.
yeah, it's just wow, that's incredible. It's a lot less. It's about a 4 or 5.
That's a great change.
Yeah.
I mean, for just a short period of time, right? So it seemed almost impossible that what we did worked,
Yeah,
but it did.
it did.
That's why
Yeah.
everybody likes Trigenics.
Yeah.
How does that make you feel?
Real good.
Yeah.
Real good.
Well, so what we always say is, you now know for sure I can help you.
Yeah, absolutely.
Yeah.
Yeah.
So great. All right. Well, we'll look forward to more success.